Medicus Mundi International would like to address Agenda Item 8.3. Our statement is supported by People's Health Movement. We welcome the progress made in this area. However, discussions on access that relate to intellectual property barriers and barriers posed by high-price monopolies are not clearly addressed. Addressing the global shortage of medicines and vaccines also requires a discussion on innovation and access to medicines. Since the harmonization of patent laws in 1995, the current monopoly-driven R&D system fails to prioritize public health needs. The lack of better norms and incentives for research and development causes the current imbalance in research and development priorities, which leave people without life-saving treatment. Several years of discussion at the WHO on innovation, intellectual property, and public health have not resolved the current innovation and access crisis. We see an opposite trend. Compromised access to medicines due to high prices no longer affects only developing countries, but increasingly patients in high-income countries too. Across countries, the public sector already invests large sums in research and development, yet without sufficient public health safeguards, the outcomes of these investments are often largely garnered by the private sector. Member states have sufficient resources and capacity to implement novel research and development incentives and regulations. For example, granting end prizes to innovators instead of patent monopolies would enable generic production of medicines from the moment of discovery and therefore de-link the price of medicines from the cost of R&D. Respecting its public health mandate, the WHO should lead and increase in implementing such new incentives and regulations to address current needs. The UN High-Level Panel on Access to Medicines report is an eminent opportunity for the WHO to reinvigorate and renew its work in this area. We urge the WHO and member states to endorse the UN HLP report and work for implementation of recommendations. Thank you.